a Gardenuity Well at Work LinkedIn Live. I am really excited about today's conversation. I'm a little bit intimidated, except for that she answers questions that everybody can understand. Dr. Reddy, thank you for being with us today.
Thank you for having me, Donna.
I think it's an important conversation to talk about wellness, not only wellness at work, but the interplay between mental health and nutritional health and community health and sleep and brain health, how that all comes together. And every time we've been together, time passes so quickly. Yes. So I'm excited to share your words of wisdom and thoughts on holistic health with everybody. But would you start with telling us a little bit about you and your journey that got you to where you are today?
Yes, of course. Thank you for asking. Well, first of all, thank you for having me. I really appreciate this and the opportunity to have this discussion. A little bit about me. So I was born in India and stayed there until I was 4. And really grew up, with my grandparents. My grandfather was a farmer, so being out in nature, being out on the rice fields, being on the banana trees, getting fresh cut coconut juice, picking limes off the tree and making homemade lime juice. All of that was an integral part of my childhood and those deep core memories. And then I grew up in Texas. My parents were both avid gardeners, and it's just been a part of my life. Fast forward to having children of my own, and we love being outside. We love gardening. It's a way to bring the whole family together. I've also just always had an interest in nutrition and how that affects health, and I think a lot of that was influenced by my family and adult caregivers since childhood. I remember my grandmother talking about, add turmeric into your food, that'll help dementia, or it'll help with memory, these kinds of things. And so I've had a long-standing interest in what we now call whole human health. And so years ago, I've been a practicing rheumatologist for some time now, but years ago it felt like there was so much public interest and my own personal interest. And so I did a fellowship in integrative medicine, and then later became board certified in lifestyle medicine. And now I have made a switch to concierge medicine, where it really gives me the opportunity to practice in kind of a comprehensive way, the traditional standard of care, using the best of what modern medicine has, but also have the chance to talk to patients about, nutrition and whole health, that kind of thing.
Okay, there's so much to unpack there. First, let's talk about growing up in India. And you continue to go to India during the summer times. And I know you shared a story with me that when your grandmother would say, let's have some lemonade, you'd go out, pick everything you needed, and make it yourself. Mm-hmm. Do you think that impacted how you look at nutrition today?
Oh, absolutely. I mean, Mother Nature is just so majestic and just wondrous, and I love reaching for those lines in the tree, kind of shaking the tree, trying to fly and reach the hard to get ones, all of that, and then having brown sugar that was in a rock and having to smash it, break it up into pieces and making it. I mean, it was creating something, and as kids we like to experiment and try new things, and so some days I'd get it right, some days it'd be too sour, some days too sweet, and it was just fun. So yeah.
See, I love that. And you mentioned turmeric, that your grandmother would say incorporate turmeric into your daily food intake because it can keep you healthy. And it seems like there's certain things that are trendy in the nutritional world.
This was long before trendy.
That's right. That's right. And so talk about turmeric. Talk about, that's something that's hot, a buzzword right now. And that you see it on the shelves, Instagram ads, LinkedIn ads, whatever it might be. But you were learning about it as a child.
Absolutely. I mean, in rural India, my grandmother didn't have any graduate medical education, and this was just ancient tradition that's been passed down. And I come from a family of great cooks, and it's just sort of passed from one generation to the next, and what we're told, and using plants to the healing properties of plants. If you get sick, you make tea with some ginger and some lemon and honey and other things. I mean, that's just part of growing up for me.
Some of the gifts of nature.
Yes,
right?
Absolutely.
Well, one of the questions, we received some questions this week from people who were tuning in today, and one of them was, did you start learning about nutritional health in medical school? I mean, you had an interest, was it part of the curriculum?
No.
No. Okay.
So, and I think that was pretty standard for back in the day. I remember visiting a friend of mine in Chicago who's a gastroenterologist, and I mean, we went to some of the top programs in the country, and here she is, a gastroenterologist, and we were having this conversation that, we could both write orders for tube feeds or for TPN, where you get nutrition through an IV, but really counseling patients on how to eat well and eat nourishing foods and nutritious foods was not a core part of our curriculum.
You know what, I think we find that more and more, and I think if I had, 10 more hours in the day, I would really get on a bandwagon of trying to integrate home ec back into school curriculums, not learning how to just sew a button or, how to make meatloaf, but actually nutritional health and financial health and all those kind of mental health, those kind of classes, but I don't. So I love the idea that you're talking about whole human health. What does that actually mean to the consumer?
Yeah, thank you for asking. Well, I've trained in lifestyle medicine. I'm board certified in that, and so using that as a framework, we talk about the 6 pillars of lifestyle medicine, and so that being, obviously nutrition. That's a key pillar there, and making sure patients are eating healthy foods, anti-inflammatory diet. I'm a rheumatologist. It's a common question I get. People love reading about it. Physical activity, it's not just exercise, but there's just daily movement. There are 4 components of physical activity. So not only cardiovascular training, but muscle strengthening, flexibility, range of motion, balance. These are all key components of physical activity, and so really breaking that down and making sure we address all of that. Sleep, that's often overlooked. Sleep is just so important. Limitation of risky substances, so illicit drugs, nicotine, alcohol, those kinds of things, and trying to limit that. Stress management for obvious reasons, and then positive social connections. So humans are social beings.
Well, I love it, and we've talked before that gardening actually has an interplay with every one of those pillars, which is interesting. So did any of your fellow doctors go, lifestyle medicine? I mean, was it kind of like, she's kind of going off the deep end?
Yes, so great question. I finished my training back in 2002, so it's been a while now, and back then, I think talking about diet and talking about some of these complementary or non-standard of care things was very much out in left field.
Okay.
And so there were a lot of skeptics back in the day to talk about diet and the influence on health, et cetera. But now, times have changed, and we're now seeing this whole human health movement, food as medicine movement. We're now seeing graduate medical education incorporating nutrition and other things. There are residency programs that now have that as part of the curriculum, and we're seeing more and more education in that schools as well. So, which is good. The time is changing.
Yeah, time is changing. Just like how we interact with our doctors. I mean, I love that you're also your doctor, so you can spend more time with your patients and really get to know them. So what is the harmony or the interconnection between nutritional health and mental health? I know October 10th is World Mental Health Day. Mm-hmm. Every day is Nutritional Health Day, although some days, you might need some Oreos and a Diet Coke. But what is that interplay
of mental health
and nutritional health? How do they interact?
It just goes hand in hand. We know that food, your dietary intake affects your gut microbiome. And so when we eat, we're eating not only to feed ourselves, but really to feed the trillions of bacteria and whatnot in our gut microbiome. And the more you have a diverse and healthy gut microbiome, then the more those bacteria, break down products that signal back into the bloodstream and back up to the brain, and really influence mood and mental health.
Okay, and what are some, I call them micro steps, habits too small to fail.
Yes.
What are some little things you would share with some of your patients? Things they could do instead of, because if somebody says you need to go on a diet, you can never have this again or that again, it's kind of daunting, like a New Year's resolution. But what are some micro steps that you share with your patients on how they can really get to a healthier, holistic place?
Well, I think, I try to go through those 6 pillars, and usually I find most people are doing well in some of the pillars, and there are others that we need to focus on. And so I think really helping people prioritize and not trying to do everything all at once is important. So I help them prioritize, where we can make the most progress. And, like weight loss, for example.
Right.
I think if a patient says, oh, I need to lose 50 pounds, well, that's overwhelming. But if you say, well, let's try to lose 5 to 10 pounds, then their knee pain gets better. And that's data driven. So starting with just small steps, like parking farther away in the parking lot, take the stairs, get up and walk for 10 or 15 minutes during lunchtime, get outside in the morning. First morning sun exposure is good for vitamin D synthesis, for your sleep-wake cycles, that kind of thing. In terms of diet, I'll ask, how many servings of fresh fruits and vegetables in a day do you eat? And so if they say 0 or 1 or 2, then we try to increase that a little bit and aim for 3 to 5 in a day. So we just start small, make very concrete goals, and then I see them frequently and follow up on that.
And how has the healthcare industry reacted to actually how we live and work today? I mean, it's not everybody can take a shot and lose weight, right? And there are pros and cons to everything. So how is the healthcare industry and the insurance industry reacting to your approach to holistic wellness?
Gosh, I wish I had some answers.
Yeah, I know, that's a hard one.
I think we're moving away from that mindset of sort of for every ill there's a pill, so to speak.
Okay, I've never heard that. That's fantastic. For every ill there's a pill. Okay, that's really good.
And we're having more and more conversations around lifestyle medicine, around prevention, around doc, what can I do? And so it's not just here's a prescription and see you next time, but it's more, in the meantime, let's make sure that you're more active. Let's make these concrete goals towards movement, towards sleep, towards eating the rainbow, shop around the edges of the grocery store, cook more at home, cook 1 to 2 days a week, that kind of thing. Just starting with very small concrete steps.
And do you encourage those in your world to read nutritional labels on packaged foods?
I think that is ideal to be aware. There's a lot of things that are hidden, and I think it really takes a lot of education to read nutrition labels. And so, I'm actually glad you asked that question, because I want to take a moment and talk about whole foods.
Okay. Yeah, of course.
So, Mother Nature makes whole foods, right? So if you can find it out there, then that means it's a whole food. So take an apple, for example, that's a whole food. Then you slice it up in the kitchen, now it's minimally processed, okay? Then you take it and you cook it into applesauce or something, now that's sort of moderately processed, but then you send it off to a factory, add a whole bunch of ingredients that you can't pronounce.
So it's not just meat.
And you make shelf-stable apple juice.
Right.
So now, let's say a diabetic patient they may have trouble with drinking that apple juice and might spike their blood sugar, but they could probably have better luck with eating a whole apple because there's so much fiber in there.
Okay.
And so when you're reading labels, it's hard to really know all the different names for sugars or the sodium, that kind of thing. So really, if it has more than 5 ingredients in it, it's probably ultra processed. And eating more whole foods is really the best.
Yeah. So it's interesting because we've done some work with this global organization called Feeding the Blind. And it's when they're in a grocery store, if they don't have the eyesight to read labels or identify whatever it is they're looking for, they have an app on their phone. And so whoever is a volunteer with, Feeding the Blind, they pick it up, they put their phone to the ingredient label and read it to them. Because sometimes the font's so small. I wish we had a way to put our phone to an ingredient label and it would interpret some of those crazy words. I mean, I was asked the other day to do a comparison between this ingredient label and some of the things that you find in your garden. So what's the ingredient list for basil? Basil. What's the ingredient list for Swiss chard? Swiss chard. And I think that kind of brings it to your attention that there really is a lot in there that we don't need.
Exactly. I think sugar has like 40 different names. There are 40 different names for sugar.
Wow. Yeah, and they're all hard to read. And the font size, and this is coming from somebody older, the font size I think is like 0.008. So we talk a lot about things going on at work, and I know you deal a lot with leaders. And so I always say that if a leader takes care of themselves in self-care, they give others cultural permission to do the same. Do you feel like nutrition plays a part in the burnout we're seeing with the workforce across the country?
I do. I mean, I think, we've already talked about the food, nutrition, mental health connection. But I think when you look across society and even across the world, people are cooking less. People are eating out more, ordering takeout more. I myself am guilty of that. And so just having the time, meal, preparing, outsourcing, getting your other family members to come and help. Those cooking skills, you mentioned home economics, like it sure would be nice. And so I do think that people, both in healthcare and leaders, that practice those self-care habits and that eat well, sleep, exercise, etc. I think that they lead by example.
Well, and I think nutrition is a benefit every leader can give their team.
Yes.
It doesn't mean they have to provide certain snacks in the snack room, but it's this understanding of what nutrition is. Every leader can share that with their team as a wellness benefit. So you grew up in India, your parents still garden, I take it, and they're here in Texas.
Well, I grew up in Texas. I've been here since I was 4.
You would go back to India in the summer. And you shared the turmeric advice from your grandmother. Are there any other tidbits of advice that you're seeing come full circle now from your childhood?
Oh my gosh, so many. I mean, I think one of the main things is just getting outdoors. Being outdoors. We know that being out in nature just really decreases your cortisol levels and the stress hormones, all of that. It helps with sleep. I mean, I was outside all the time. When I was in school, I was outside, and whether it's just social and playing with friends or just, I don't know, riding my bike or being in the garden, whatever it was, we were outside as much as possible. We weren't on screens and that kind of thing. One thing I wanted to mention is that when I talk to our patients about diet, I don't think of just food. I think it's important to think about, really your diet is everything that you're consuming. And whether it's in the form of food or, information or an information overload.
Okay, that's interesting.
And so all your inputs, right? So whether it's from social media or from the news or from, friends and neighbors, I think really managing your inputs and everything that you're consuming, surrounding yourself with good influences, whether it's friends or colleagues or whatnot.
Right.
You know, everything, we're subject to our environment in a very holistic way.
That's so true. Well, I think that it's a conversation that I'm glad is happening between families.
Yes.
And that's one of the things that we celebrate, that gardening opens up that conversation. You know, when you garden with your fruit, you talk about it. Or when you harvest some fresh thyme to put on a salad, you talk about it. And I think that's exciting to see that we're really interacting with all of the key pillars. Where do you see nutritional health and mental health in 5 years?
Oh, I don't know.
Yeah, I know, that's a hard one.
Hopefully better, you know.
Yeah.
Hopefully we've made some progress. I mean, I think the future is really going to be more solidifying wraparound care. You know, not only seeing the doctor, but kind of having a team-based approach of whether it's a dietitian or mental health or, you know, fitness or health coaches, that kind of thing. And I think also focusing on prevention and true health care, you know, not so much disease care, so to speak, but true health care and maintenance of health and healthy aging. You know, there's a term now that called health span, right? So not just living longer, but what percentage of your life are you living healthy, active, and being able to do things you want to do.
See, I love that, and I think it's about living healthy every day. So here's last question.
And aging healthy.
And aging healthy, that's exactly right. Well, there was a study just released that talks about how to add 7.5 years to your life, and it didn't have anything to do with nutrition, or it didn't have anything to do with exercise. It was how you perceived, what your mindset was towards aging. And I think we live in a country that, you know, is scared of getting older. You know, what can we do to look younger? What can we do to do this? And I think sometimes just celebrating the fact that we have the opportunity to get older is a good start. So are there any good books you'd recommend to somebody who's starting out on a journey of really bringing holistic health to them, their families, and their teams?
Oh, goodness, so many. I love the book Atomic Habits by James Clear. I think it's such a great book and just so many nuggets of wisdom. And you can just sort of pick it up and find a couple things, and you know, does a nice job of sort of bite-sizing it. And so I think that's a great one. There's a nutritional psychiatrist named Dr. Letier from Harvard, and she's written multiple books now, kind of on food and mood and brain health, that kind of thing. I think those are some of the good ones to start with. Peter Attia writes some really good books on healthy aging as well.
So why is it, I have to throw one more question in. Why is it if you're kind of sad or tired, you crave chocolate? I'm like, really?
I think you get that instant sort of reward, right?
Yes, you do.
Your brain. I mean, I'm a chocolate lover as well.
I'm trying to go to the dark chocolate, but it's not like, I wish when I was really exhausted, I craved basil or a little piece of Swiss chard. But in fact, I'm craving chocolate like so many people.
It gives you that instant reward.
Instant gratification, that's right. Where do people find you? How can they get in touch with you?
Oh, yes. Well, I practice at North Texas Preferred Health Partners. mtphp.com is our website, and all our information's there.
Good. Well, thank you for joining us. Thank you for sharing this information with us. And we look forward to continuing our conversations and growing together.
Sounds wonderful. Thank you so much. Appreciate it, Donna.
Absolutely.